We've all had a crick in our neck or sore muscles at one point in our lives, right? We all do that. But my next guest, Mary, has been living with daily chronic pain for the past several years. She's been managing the pain using over-the-counter medications, but with it gradually getting worse, she wants to find a more effective method of relief.
I feel like a little old lady when I wake up in the morning. I've suffered from chronic pain for at least 10 years. I'm currently taking an over-the-counter pain reliever every day. It hurts me to stand for any length of time or to walk slowly. Shaking hands is very painful for me. Holding onto a pencil, that hurts as well. Pulling weeds, anything where you're bringing your fingers together. Many times I'll wake up in the morning and my back hurts so bad. Getting up out of bed is extremely painful. The pain feels like throbbing in all of my joints. It's a huge detriment at work because I'm required to be on my feet for a long time and I can't stand the pain. I miss out on things such as volunteering and shopping. I always have to take breaks. I'll have to go sit down for a while because my back hurts so bad. In the last few months, I've had pain all over my body. I'm at the point where I'm going to need more than my current pain reliever. I've tried a lot of different pain relief and I'd really hope that there is something else out there, something new that I can try.
Well, Mary is here along with our good friend and a viewer favorite, Dr. Freda Lewis-Hall, Chief Medical Officer of Pfizer. Living with pain is something I can relate to as well. God, I have shoulder pain, elbow pain, knee pain. It's just, oh my God. Dr. Freda, what are some things that can be done to manage this chronic pain? Because it's just all over you, right? You have it in your hands, you get jars, everything.
Very true.
All right, so we'll talk about that. So talk to us.
You've made the very important first point, and that is chronic pain is very common and it's very complex. So there are 100 million Americans who live with chronic pain, 100 million. And it's really important to understand that if you've met one person with chronic pain, you've met one person with chronic pain because it is so complex, it's different from one to the other. So there isn't going to be one solution that fits for everyone. In fact, there isn't really one solution that necessarily works for the same person all the time. So people always ask, well, why is it so complex? There's so many different causes, there are different types of pain. The severity can vary from person to person and within one person, and it can affect your daily activities in a very different way. Sometimes it affects work or sleep or some of the things that you talked about. Right. So the key is to put a treatment plan together that takes all of those characteristics into consideration. So let me start by asking you, if you can describe how your pain has affected you. What does it feel like? How much do you experience pain?
My pain is, I have arthritis in both of the joints of my thumbs, and shaking hands hurts. Holding a pencil for any length of time is painful. And sometimes I'm not doing anything and I can just feel like little stabbing pains in both of my hands. Opening jars, as we talked about, is very painful. Anything like that. I also have back pain. I wake up every morning with back pain.
Are there some days that it's like almost not there and then other days that you can barely get around?
I always feel a little bit of pain every day in the thumb joints. The back pain is not every day, but almost every day. Yeah.
Some days I feel like, oh my God, I can barely move. Then other days, I feel great. And so those days I overdo it, and then the next day I feel really bad. So it goes up and down. So Mary's talked about taking over-the-counter pain relievers every day. Are you doing any other treatments besides that?
I've had some prescription medications that I've taken as well, and some vitamin supplements. I'm concerned with taking medication every day, especially either over-the-counter or prescription. I mean, long-term, is that bad?
Well, first of all, you are spot on to consider both the risks of taking any medication you may consider as well as the benefits. But this might be one of the benefits of working with your doctor and a healthcare team really closely on working out a treatment plan for you. Oftentimes that helps with chronic pain. Essentially, this team can get together and help you characterize your pain, can help you think about what your treatment goals are, can take a look at all of the options that are available, both medication and non-medication options, as well as looking at the risks and benefits, which you said you were concerned about in there. And then you set a plan, you monitor the plan, and you change the plan as necessary. Different types of pain respond to certain medications. And so having a treatment team, and doctors are, kind of the best advisors on this, can help you pick the medication that's appropriate to your types of pain. And then you would set a dosage and a period of time that you could really see that medication, if it's working and what challenges might be, and then change it as necessary. In addition, there are so many non-medication or beyond medication options that you might want to consider. For example, we know that behavioral therapy and relaxation techniques can work, exercise, physical and massage therapy, yoga, acupuncture, that's just mentioning a few.
Do you do things daily that work for you? Like, do you stretch? Do you relax? Do you do some of the things she's talking about that work for you?
I do find that I enjoy working out, and walking is my favorite thing, and walking helps with the back pain significantly.
Yeah.
That's very helpful.
Yeah.
Yeah.
And you had mentioned diet. I prefer to think of it as nutrition,
Right.
right? And of course,
Right.
that's important.
Yeah.
Nutrition is very important, so I'm glad that you brought that up too. Maintaining a healthy weight can help make exercise less stressful, and it can also help back down the pain a little bit. So that's also an interesting area that you can talk to your healthcare team about.
Right.
Yeah,
Okay.
and you actually have some tools that people can use for getting with their doctor, meeting with them, and being ready, right?
Absolutely. This can be surprisingly hard to talk about. So if you go to gethealthystayhealthy.com, we have some pain assessment tools as well as discussion guides that might be helpful to get this conversation started with your doctor and the other members of your healthcare team.
I think words are really powerful. And I think if people say, oh my God, it's just killing me, it's this or that. But the pain assessment tool helps you really get this in kind of quantified and qualified as well, so you have a way of measuring it from one time to the next and one day to the next. And that is a great tool on gethealthystayhealthy.com.